Good evening, and welcome back to Better Health Through Chiropractic. I'm Dr. Jeffrey Jenkins, and we're joined in the set this evening by Dr. Jerry Dombrowski and one of his patients, Loretta Wire. Loretta, can you tell me how you come to meet Dr. Dombrowski?
Well, Dr. Dombrowski actually found me through connections. I was looking for alternative care for Indians to bring on a reservation. And we were doing a health clinic, and that's how, through other connections, he contacted me. And that's how I came to meet him.
Excellent. And so you underwent treatment with Dr. Dombrowski, is that correct?
That's correct. Being that we were checking out his philosophy and how he treated patients, I became his test case in which to work on. So I came to him for treatment, and he treated me. And I did have conditions. I didn't tell him the conditions that I had when I first met him, but he, of course, discovered them, and they happened to be 2 mass in both my breasts.
Aha. Now, prior to seeing Dr. Dombrowski, did you see other doctors for these conditions?
Yes, I did, and I've had mammograms, and we were watching them. I have to say that I've had good care from my general practitioner, who also believes in alternative care. So he just wanted to watch and see whether or not they grew. And we were going to take a less aggressive approach. He gave me a choice whether or not I wanted a biopsy, and I said no, I wanted to check out another way, and that's about the time when I met Jerry.
Excellent. Was there any other doctors prior to that that you seeked diagnosis or treatment from?
Well, I did have another doctor who first diagnosed it. The suggestion at that time was to go ahead and have the biopsy. I changed doctors, got a second opinion, and the second, my doctor that I have now left it up to me and my choice.
Excellent. So tell me a little bit about what happened once you came under the care of Dr. Dombrowski.
Well, Jerry let me know exactly what he did, and he walked me through the whole step of the way, of the process, what it meant. I'd ask him questions. What is it, what he was doing with kinesiology? How is it going to affect my body? He would be very kind when he was treating me in answering all my questions, not only for myself, for other people that I had to bring this information back. So in that way, we went through and he told me what's going on with my body and what it is that he needed to do to affect a health change.
Excellent. And what kind of health changes have you seen with the treatment?
Well, my first paper that said mass, now my last mammogram came back as normal. And
wow.
Both mass are gone.
Absolutely incredible. Fantastic. And congratulations. Without the biopsy?
Without the biopsy, yes.
No cutting?
No cutting.
So Dr. Dombrowski, what the heck did you do? How did you help Loretta with her condition?
See, the body's geared towards, it has all of its innate abilities to heal itself, and that's how it's going to function. And what happens with a condition, whether it's what Loretta has, or whether it's cancer, or whether it's cerebral palsy, what it is, all it is it's basically there's a stoppage of nerve flow. So you can compare it to, like, you have this river running through the wilderness, and you put a dam up. And what happens is that dam causes the water to stop right there and causes a backup on the other side. And what happens down the other end of the river is all the functions that used to go on down there, all the fish and the deer and the antelope where they used to play, they don't play anymore because of the dam. And what ends up happening is on the side where the dam has been put up, or you can label that that dam a subluxation, or you can call it neurological disorganization. What ends up happening on the side where all the water's building up on the dam is congestion. And with congestion on one side, you end up getting paralysis on the other, and paralysis leads to loss of function. And loss of function leads to disease or a disease process, whether it's masses or whether it's cancers or whether it's cerebral palsy or whether it's immune deficiency problem. There's not optimum nerve flow, or there's not optimum communication between the diseased part and the central nervous system, because the central nervous system controls everything that goes on in the entire body. And what we did, or what Loretta did, and I just went in and just found that where the dam was built, or I found the subluxation and fixed the neurological disorganization, and the body took care of itself. And that's the reason why everybody in this room or everybody out there watching the show does not have lumps or cancer or heart disease or anything else along those lines, is because their body's already functioning properly in order to take care of that particular problem. And then those people who do have that particular problem, that's where the deficit comes in, that's where the neurological disorder is, and my job is just to find it and then correct it and enhance what the body's already has there to take care of itself.
Excellent, excellent. Do you use anything other than your hands for your treatments?
Sometimes I supplement with vitamins or mega dosing of vitamins, depending on what the condition is, or a therapy called Homazone, which is a blood oxygenator that you take orally. It all depends on what the condition requires. Like with what Loretta came in with, there was only, I just used my hands, and I didn't supplement with anything else.
Excellent.
And she just took care of herself. She just took care of herself, and everything turned out okay.
Super. You know, when you talked about the philosophy that you wanted to test out Jerry's philosophy of health to see if it could help you, right? When we talk about health, and if we look at it from a definition from Dorland's Medical Dictionary, okay, which is the standard test used in medical schools and chiropractic colleges, but the definition of health, if you look it up in Dorland's Medical Dictionary, is a state of optimal physical, mental, and social well-being, and not merely the absence of disease and infirmity. And it's in direct contrast to another system that, again, if you have a symptom, we treat the symptom. And this, and apparently what Dr. Dombrowski has been able to do with you, is just to allow your body to function at that optimal level.
That's correct. Our philosophy that we were looking for Indian people was wholeness. We believe in a total, we wanted that type of philosophy for medical care, which doesn't exist now on reservations. And Jerry did prove that that was a big, strong component of chiropractic care that he brought to the table.
Excellent, excellent. So as you were the sample case, right, and you were to come in and test out his workings, were you then able to go back to the Indian tribe and send other people to Dr. Dombrowski?
Yes. Actually, I got him to go to a tribe in Hoopa, which is Northern California, pretty isolated. He was kind enough to go along and endure the trip. For a friend of mine who also was very ill. He'd been in and out of the hospitals. He's got diabetes. He just had a 5-way bypass at 45 years old.
Wow.
His health was deteriorating. They were taking his gallbladder out. They had just pieced him. And he was in and out of the hospital at least every 2 or 3 weeks. They really didn't give him a whole lot of hope for a longer life. And so I asked Jerry if he would come and then treat some people on Hoopa so the Indian country could see what he had to offer, and that he did.
Excellent. Now, how long was he treating you for your case?
I don't know, probably 6 to 8 months.